Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello, everyone.
How-
Welcome. Hello, Andre. How are you?
Yes, we are back on more frequent recordings after summer.
Yes. True. It's good. It's good to be back. On track. Okay. So today we are going to talk about work conditions, but in a very particular scenario. So, how to negotiate your work conditions in dentistry, and because I think it's quite peculiar in dentistry, and we were talking about this before starting recording, that because dentistry is quite it's quite a technical work. Sometimes just the words on your CV, and you might have a lot of pages on your CV. But in dentistry, they don't. They mean something, but for you to show your value, it's quite another thing. So we're going to talk about this today. But the first topic that I want to bring to the table is work conditions equals money. So when you are negotiating your work conditions, are you negotiating your salary? Are you negotiating a salary? Or are you negotiating something more than that? What do you think? What is your view on that?
So I think that's a very nice way to put it. I think it's usually when we talk about negotiating working conditions, we are mainly talking about money. Yes, usually that's what we are talking about. But it's way more than that, and especially newer generations. I think they value other aspects as well. And for me, I can talk about my experience. I would value other aspects as well. So I think it also depends on the time of your career that you are. And we can talk about that initial phase and then a more mature phase in your career. But when we are, especially on the early stage of our career, we are not only talking about money by no means. I mean, there's a whole different other assets that you can eventually that can place some weight on the decision. And I was thinking about, of course, the working hours, right? It depends. And when I mean working hours, if you have a job proposed that it's needed that so you're going to have to work 4 or 5 days of the week in this practice, but you'll need to work like every Saturday. That can be, it depends on your goals. It depends on your personal life. You can accept that or not. I mean, so working hours can be beneficial or not. Another thing can be the location, right? I mean, if it's a practice that is very convenient in terms of location, that also weights on the decision. Another very important thing that is very dear to me is the possibility of evolution. For example, and I talked about this many times in the podcast. I think that when I started to think about opening a practice, my goal was to document cases, right? So, and that's the reason why I opened a practice. If I had an opportunity of someone that would rent me the space or that would allow me to spend like 3 or 4 hours with a patient to document a case, that probably would have, I would have thought twice about opening the practice. So if I have the chance of eventually document cases. If that is what eventually some of the listeners want to do, that's also something that waits on the decision. If someone tells you, look, you're going to work here, but then I will allow you like one morning or one afternoon a day or 2 hours a week or 3 hours to document your cases, and we are not going to look about the numbers in terms of productivity, but we will also allow you to document the cases. Another thing is also the potential of evolution. I mean, if you are going to a practice that is a very reputable practice, where you know the professionals are very good, and that you can eventually learn within the environment or learn being part of the team, that's also something that that waits on the decision of your working conditions. So yes, I agree with you. I think that working conditions are way beyond the financial part only. Yeah.
And let's talk about, and you already mentioned, so it's completely different if you are negotiating your work conditions, if you are a new dentist, if you just graduated
Yeah. Yeah.
from dentistry, or if you have already some experience. So let's talk about
Yeah.
if you are a new dentist, and how
Yeah.
can you then negotiate work conditions in a practice, because we know that, I mean, and
Yeah.
there are different conditions here in Europe, in different countries. We know, for example, in Portugal,
Yeah.
there's the young generations, they battle to start. But how do you think that if you are a new dentist, how can you better negotiate your work conditions? And you already said, okay, so it's different from, it's not negotiating a salary.
Yeah.
You should also look for other conditions, but this in a practical way. And I know that you have an approach to this. You already mentioned in the podcast. We're going back to
Yeah.
that, but I know that you have an approach how a young dentist can negotiate this work
Yeah.
conditions,
Yeah.
and the way that he should work to, in order to start and to have that
Yeah.
growth that you were talking about.
I think that when we talk about someone that's going to start to practice, I think that we have to take into account that. So the first thing is that when you are recently graduated, it's you are navigating. You start navigating the world, right? And I think that it's very important to keep your options open, because you have not yet developed a very clear vision of what you want to be, even as a person or as a professional. And I think this is a very important point here. And I think it happened to you the same. I mean, so the first, let's say, strange thing is that when you are 18, someone asks you to decide what's the degree that you want to take, right? That's a little bit violent, right? This is why more and more people today, they take like a year off, and they start to work before college. And I think, honestly, I find it more and more interesting. I mean, so you graduate, you do your basic studies, and before you go to college, you took a 1 week, 1 year off, or 2 years off. It can eventually be to travel, but actually, ideally, should be something that would test your capacity of being independent financially. And I think that's very interesting. You start to work, you see what you like, you see what you don't like, because that I think that will get you closer to what are the things that you like and that you don't like. So that's the first violence. Okay, so now you took now you took dentistry, right? For whatever reason, and the most common reasons might be I like healthcare, I like people, I like the medical part of a profession, in terms of being able to help others, being able to contribute to the patient's health. I think that those are basically the main. I mean, I think that the reasons, but they may not be exactly the same, but the reason that makes someone choose dentistry are not that much different from the same reason that makes someone choose medicine. I mean, you just want to help in a genuine way. That's what I think that most of the people that choose dentistry. That's the reason why they choose it. Okay, so now you graduate, right? So you graduate, and then it doesn't mean that you have a very clear vision of what dentistry actually is or what you want to do inside dentistry. And let's be honest, dentistry is mainly private, right? So if it is like medicine, you are pretty much taken by the hand by the system. So you go now, you do an internship. Now you do you're trained for your specialty. Now you go to hospitals. I mean, the next 10 years are pretty much drawn to you, pretty much decided by the system itself. Dentistry is very different. Dentistry, it's mainly private. So because it's private, you have to move your ass, right? You have to really start to dig and find where what you would like to work, how you would like to work, etc., etc. But there's a big catch here, which is you haven't actually been in the field. And by being in the field is treating patients. I mean, you have 2 or 3 years in college, but it's completely different. The academic environment has nothing to do with private practice, which is what most of us are talking about. So you go into once you go into private practice and you practice for 1, 2, or 3 years as a general dentist, I think that before working as a general dentist for 2 or 3 years, I don't think that you are in conditions of knowing what you want to do or be in dentistry. I don't think that it's very rare that you find someone that has a very clear vision of exactly what they want to do. Okay, yes, yeah. In my story, I had it very clear when I graduated that I wanted to write stuff in dentistry. I mean, I wanted to write scientific articles. That was something that was a no-brainer for me. But I think that's an exception, right? I mean, when you have someone that has this creative pull towards writing something, that's one thing. But I don't think it's very common. But if you have that clear, it's something that is completely natural in you. Of course, that you have to go for it. But I don't think that is the most usual stuff, right? So I think that you have to be really careful of being. I think that you have to, the first 2 or 3 years, your main goal, in my opinion, is to learn. Because that's your richness. Your richness is learning. So the first 2 to 3 years, you have to learn, right? And there are several reasons for that. I mean, one of them, it's very important. You may hate dentistry. Let's be honest. So if you experiment and if you hate dentistry, the first thing that you have to realize, if it's something completely unbearable, you have to change your direction somewhere else, right? So, I mean, there's nothing wrong with that. And I really like this experimentation approach. I like the I don't know philosophy, and I think that we're probably going to talk a little bit about that in the future. I mean, but having an approach which is, especially when you are young, which is, okay, let's test it, let's see how it goes, right? Let's start to work with patients. Let's see what I like. Do I like surgery? Do I like orthodontics? Do I like prosto? Do I like endo? Do I like perio? I mean, there's so many things that you can eventually, I mean, do I like, would I be a good teacher? Do I like to teach? What do I think about creating something or writing something? Are those things that attract me, right? And I think that for that, you have to start to work. But when I mean that the main goal is learning, it doesn't mean that you have to be exploited in work, right? You don't have you have to have what I would say minimum working conditions, minimal financial working conditions. Yes, your goal is not to get rich in the first 2 or 3 years. Your goal is to learn, right? So I think that is the first thing, because I think that only by learning you can know exactly what you want, and then you can negotiate your working conditions. But it takes time to learn, right? It takes 1, 2, 3 years. I would always advise anyone that starts dentistry that really wants a career in clinical dentistry, because some people they want a career maybe in academic dentistry, or I don't know, public dentistry, or you don't have to be a dentist. If you took dentistry, you don't need necessarily to be a clinician. I mean, you can do something else. But for the vast majority, that's what we are talking about. So, okay, so test your clinical skills. So learn the clinical skills, right? And if it's something that you really like, don't bother about being lousy with your hands. We had the Professor Antonio Mata here on the last podcast, and we were talking, and he was telling us that he had very big obstacles with his hands. He thought that he did not have his skills with his hands were not very good, but he just kept practicing. And for me, it's the same thing. Today, I consider myself to have very good hands, but it wasn't like that in the beginning. So I think that I had to work extra hard. So I think that in the first years, the main goal is to learn, right? So do whatever it takes to learn. And if you really, really if you are really, really serious, sometimes you find those kinds of people. People that, look, I want to be the best clinician in Portugal. I want to be the best clinician in the world in a specific field. If you feel something like that, if you really feel something like that, I would sacrifice myself to learn with the best. I would do that. I would try to search for the best opportunities. I would ask people to go and see them working for free, or to help, or to be like a nurse for free in your free time. I would do things like that, right? But that does not mean that you need to keep living at your parents' expenses in the first years. I think it's at the same time that you are a learner, you need to seek for your financial independence as soon as possible. Because when you learn to pay your own bills, this is when actually growth happens, right? The possibility of starting to live alone, it's very important as soon as possible, saving money as soon as possible in order to be able to do that. So yes, having a learner mentality, and of course, you are not going to expect that you are going to be paid as you would like to be paid, like in 10 years, but you need to try to search for financial independence as soon as possible during those 2 or 3 years. And sometimes it's very difficult. This doesn't mean that you need to eventually hold for 1, 2, or 3 years in your parents' house. But if you do so, do not get accommodated with that, because you have to. I mean, you may eventually be saving some money, but that money is to be saved for your independence, right? So I think it's very important that we understand that being financially independent as soon as possible, it's very important. And it's also one of the other options is to travel to and to live in somewhere else, live in another country, because, and we'll talk about that in some situations. That's even in the first years, that's the thing that you have to do. But I think that the most important thing, if you want to be a good dentist, a clinician, it's to learn. That's the main focus. You have to learn you have to learn and to test and to place yourself into difficult clinical scenarios so that you can eventually understand who you are as a clinician, what you like as a clinician, how you see yourself in the future as a clinician, and then you can eventually think about negotiating your working conditions. So I would say that, in a nutshell, I would like to work with, I would say, average financial conditions in the country that you have chosen to work. I would like average financial conditions, and then use that opportunity to learn, either in the practice that you are, or just ask someone else to go and look at to help them in the appointments for free. Yes, for free. If you have some free time, just do that. Go, and I'm not talking about treating patients for free. I'm talking about asking someone, look, I can be your nurse. I can help you clean the rooms or something. I just want to see you doing surgery. I just want to see you placing implants. I just would like to see you doing preps or bonding veneers. Just And I'm not asking for anything. I'll behave here. I know. Just tell me how I should behave, and I will be here, and I will be watching you work. Because the amount of benefits that you can get from that are really huge. Okay, so my first thing would be search for average conditions in the country that you have chose, and try to learn as much as possible while you are working and in your free time. Just try to get some mentors and try to help them. I mean, simple stuff. I mean, okay, I can tell you, like, okay, I would like to assist you, and I'll just help your nurses doing something. I'll be more than happy to help, because this is I don't see this as common today. I don't find this attitude very common today. And when I look back, people that really got interested by my work a few years ago are now very my work, and that people that have that mentality are very, very good clinicians. And I think that today, sometimes people ask me, "Oh, I'm gonna go and see you work," and they come for once or 2 days, and then they realize how intense it is, because you are like 8 hours or a full morning standing there watching me doing surgery, watching me manage my practice, or watching me talking to patients. And it's boring, there's a lot of things that are not very sexy. I mean, the normal stuff, of course, that there's some very interesting stuff, but sometimes it's I may eventually have an afternoon that is not very interesting from a clinical point of view. But you always learn by watching me talk to patients, presenting treatment plans, and doing stuff like that. And I think that most of the clinicians, undervalue that possibility. And I always say yes when someone wants to watch me practice, always. And I think that most clinicians would say yes. So number one focus, first years, try to get financially independent, try to learn, and just accept average working conditions in the first years, because you have nothing to offer. You have no conditions whatsoever to ask for anything, because number one, you don't even know who you are or what you like, and you haven't proven anything yet. So that would be my advice for the first 2 or 3 years.
And let's go a little bit further then. So you have passed those 2 or 3 years, and you were able
Yes.
already to understand a little bit better what you want. You were already able to
Yeah.
develop also some
Yeah.
of your technical skills, which is very important. Like you
Yeah.
said, the first 2-3 years are not only to learn but also to develop technical skills.
Yeah. Exactly.
And then you already have some experience, you already
Yeah.
know a little bit, you already are or
Yeah.
inside more of dentistry and of the game that is
Yeah.
played.
Yeah.
And in that situations, how do you negotiate then your work conditions? Because
Yeah.
at that stage, you no longer want to work as a dental nurse, for example. Because I find it very
Yeah.
interesting what you say, and I think that you learn a lot by watching others work also. But in order for you to develop not only the learning but also your technical skills, you have to also work. So that two
Yes.
3 years, it has to
Yes.
be that balance, like you said, about
Yes.
watching others
Yes.
work, trying to do your
Yeah.
own work, knowing that money is not your main goal, but you have to start working. But okay, once you go
Yeah.
through that 2-3 years, you are now in a position of start negotiating your
Yeah.
work conditions.
Yes. Yeah.
What would be your advice then?
Yeah, I think that so I think that after the first cycle, I would say, well, at least 1 year. I think by the end of the second year, you're in a position of knowing, look, I like this, I don't like this, and this is why it's very important for you to be exposed not only to one single practice, but also watch other people work. I think this is really important, because you should not limit your influence to only one practice. I mean, you should be influenced by many different points of view in different practices. This is why I'm a big fan of asking to see someone work in different practices, just for you to understand how they work, what they do. And I mean, no one is going to be offended by asking, look, I would like to watch you work. And I think it's really something that these people completely forget, and they don't take this opportunity because the opportunity is there. Most of the people that I know would allow you to do that.
Do you think it has to do with the fact that I have this opinion that nowadays more and more young people start to get specialized very soon? Do you think it's because the fact that they specialize, so they think that they don't need because they got more because they get out of the
Yeah,
university, right? And they go
yeah,
immediately to a specialization. They have to have
yeah,
the money to pay that specialization, so they need to work. And once they get into the specialization, then they are just in one field and they are learning from that people that gives them the specialization course, and they don't feel the
yeah,
need of learning from others. Do you think it's that
yeah.
happens nowadays?
I think that's part of the reason, and I think there's not one single way of doing things, and we are all very different. But in general, I would say you would always be a better dentist if before you specialize yourself, you do at least 1 2 years of general dentistry. I think that you'll always be a better dentist if you do that because
But you agree that there's this big hurry on getting
yes,
out
of
of
course,
university
yeah,
and getting a specialization
yeah, yes, it
nowadays?
is, yes. Yeah, but I think that you can eventually do that simultaneously. I mean, you can eventually start to doing your specialization, and at the same time practice some general dentistry. I think that you can. I mean, it's a full if it's a full time specialization, it's different. But most of the times you'll have time. You'll have time to work as a general dentist. What I see when I look back and I think about people that I know in Portugal and abroad that always followed the path of they ended college and they went immediately to work as a specialist. Most of them they also worked as general dentists or they had some side jobs to be able to grow as clinicians as well. So I think it's in the first 2 years, even if you have like almost full-time specialization, you should get some time to be a general dentist. That's what I think. And yes, today it's more and more common to be a specialist, but I think that you will be a more efficient clinician in your specialty if you have some experience in general dentistry for 1 2 eventually 3 years. That's my point of view. Having said that, it doesn't mean that it needs to be necessarily this way, that you need to delay your specialization. But you can, I think that you should have like once a week to work as a general dentist or an afternoon a week at least, even if you're doing your specialization, because that will keep your ego checked, right? Because I think it's you when you end university and if you go for a specialization, I think that you have a very distorted vision of the reality of dentistry. And we talked about this very much, which is dentistry is difficult. It's not. It's a demanding profession, and I think that you have to test yourself. This is why I love the concept of experimentation, because you are in the field, you are feeling. What do I like? What don't I like? I go and see this guy work in his practice. I like this. I don't like that. I go to see someone else. And I think that getting that feedback, getting yourself exposed to as much as possible of different experiences is very, very, very important. But I think that you are right. I think that the fact that people go to specialization very soon, it's one of the reasons that they don't go through the experience of general dentistry and watching some other people work. Yeah, but coming back to the question, which is okay. So this initial cycle is going on. I mean, you are working as a general dentist, and now you realize that you want something else. You may eventually start to get some clarity of what you want to do. Maybe I want to do prosto, maybe I want to do ortho, maybe I want to do perio. Okay, so this is what I want to do. So I need to improve my working conditions. I think that I can give more, and therefore, this is very important. I think that I can give more, and therefore I would need to get some specific conditions. And again, those are not necessarily financial. It can be to have the possibility of documented something. It can be the working conditions in terms of materials as well. Okay, that's something very important as well.
Which in dentistry is very important.
Yes. Working conditions in terms of materials and stuff, and like time for the appointments, for example. Okay, so we are usually talking about financial, yes. We are talking about possibility of evolution. We are talking about working hours. We are talking about practice location. Sometimes you may say, well, I'm too far away from home. I need to get closer from home. Okay. So one thing is negotiating the working conditions within the practice that you're working, right? The other thing is trying to improve your working conditions to go to some other practice. So let's focus on the first one. The first one, you work in this practice and you want to improve your working conditions. So in my point of view, one of the things that is really essential here, and I've talked about this before, is to convince or to try to boost the existence of an initial examination appointment. Because this is really the motor of every practice. The initial examination is what will bring you the work that you need, is to give you the opportunity to do a correct diagnosis and then to present a treatment plan. And actually, if the listeners, they have doubts, you can go back to one of our podcasts, and we have a full podcast about the initial examination. So to make a long story short, initial examination is basically the biggest treasure that you have in your practice. That is what will allow you to do the dentistry that the patient needs, and not only the dentistry that they want, right? It's not about forcing the patient to do certain treatments. It's about making them aware of what they need and presenting a treatment plan, and therefore having the opportunity to work to practice a dentistry that you are really proud of and that you really want to do, right? So the initial examination is really important. In that podcast, we talked about the importance of the checklist. We talked about the importance of having adequate time for that. This is really important, right? So one of the things that you can do if you work on an existing practice, you can say, look, I think that we don't have an initial examination here, or the initial examination is not structured, is not well communicated in the reception. And I think that if we do the initial examinations, we will have these and these and these and these advantages, which will bring us more treatments to do and will be more professional. And I think this is the way to go, right? And you always have, when you propose a change, you always have to place yourself in other people's shoes. And you can always say, look, I understand this is a change, and changes sometimes are difficult, but I'm willing to help in that change. So I'm willing to propose initial examination checklist. And I am even willing, because I understand that charging or not charging an initial examination may be an issue. For example, in Portugal, I know it's an issue. I don't think you should. I think you should charge it. But sometimes it's an issue and people undercharge, or sometimes they don't even charge, which also has some legal implications. But I think you should charge. But what you need to understand is that you need to place yourself into a position that you are not doing the initial examination for the money. You are doing the initial examination because it will bring you the treatments and therefore the financial rewards that you are looking for. And I think this is why it's so critical that you try to advocate and boost and promote the implementation of an initial examination everywhere that you work, because that is the secret. That will help you to do a correct diagnosis, to give you time for diagnosis. That will help you learning how to talk to the patient, eventually talk even about financial constraints and treatment planning. And that will make you grow a lot, and it will bring you a lot of treatments. I mean, I usually say this, you don't make money. And when I talk about making money, you have to understand that I'm always talking about making money honestly and well deserved. I mean, dentistry should be fairly paid. The price that people pay should be fair, so that the doctors and that the dentists can be paid what is fair for their expertise. So when I talk about making money, it's always within an ethical context. So you don't make money in dentistry by making the treatments, or by making a lot of treatments, by increasing the amount of treatments. You make money by thinking and presenting about the treatments and presenting treatments to patients. This is where you make money, because this is where you make the patient aware of what they must do. And this is a really, really central part in any practice. So negotiating for the initial examination and placing yourself in a position that you are willing to give yourself for the initial examination. You may say, look, I'm eventually willing to work for free for the initial examination for 6 months. And after 6 months, if you believe that is bringing rewards, then I would like to be paid X for this initial examination. And if you believe so, we can eventually negotiate some better working conditions for me. For example, I would like to have some of these materials. I would like to work with this certain laboratory. I would like to increase prices here and there for certain treatments. So if you believe that this initial examination is bringing something here, is bringing some positive things to the practice, I would also like to be able to work with this lab. I will also be able to work with this material. I will also be able to sometimes take more time to document a few cases that we can eventually use on our social media and stuff like that. So the initial examination is really an important part of the equation when you are negotiating. Why? Because most practices, they don't do it, or they don't do it correctly. They do something that is not very valuable. They do it like in 10 minutes or 15 minutes or even half an hour. It's not possible to do that. You have to have time to diagnose. You have to have time sometimes to go home, do a good treatment plan, write it down, talk to the team, and then present it. Always remember, presenting treatment plan is not about the outcome, it's about the process. You have to focus on doing a very good process on diagnosis and presenting the treatment plan, and then things will happen by itself. So I would say that number one is foster or promote or try that the practice that you work with does a good initial examination, because that is the treasure. That is your financial treasure. The financial treasure in every practice is the initial examination and the treatment plan presentation. That's what makes a difference. Really, it is what makes a difference. So I would say that my first hint would be that. So if you work in an existing practice, if you want to improve your working conditions, that would be the first thing. If you don't have an initial examination, just do one. But then there are a lot of other things that you can eventually.
And do you think? Sorry, before we move on to the other things, do you think, because you made this separation of scenarios, one if you are already working in a practice, and then you bring the initial examination to the table.
Yes.
But do you think that this could also be applied if you are applying for a place in a different practice? So if you want to, you can bring that also to the table.
Yeah, if you want to work in another practice, and we will come back to the first option in a little bit, but if you want to work in another practice, so let's say location is better, or it's a practice that you admire and you want to work there. I mean, no one knows you, right? Right? In the first 1 or 2 years, no one knows you. So what is the tools that you are going to use to convince them to be with you? You have to always remember, you have to give something before you get. Maybe you have already a good portfolio of cases.
I think that's in dentistry is very important, and I think that nowadays with the photography and with the tools that there are in dentistry, I think that's a good portfolio, and starting documenting your cases is much better than a CV, because if you look at cases and just words in a paper, I think that's really an important thing for dentists nowadays, for them to
Yeah.
start documenting their cases as soon as possible, because it makes all the
Yeah.
difference.
Yeah, I think that one of if you already have some documented cases for the first 1, 2, or 3 years, this is why it's important that you have to give yourself before you ask. So also investing in a camera is important, right? You're saying I think that you don't have to have like a top notch or the top model of cameras, but you have to have a decent camera that you can photograph your cases, learn to photograph, so that if you want to move on to a better practice, you have to show them your work. Look, this is the work that I have, and I was willing to, I would be willing to go there to work, but. I don't think that also if you are in, for example, in Portugal, which is there's a lot of dentists, there's an excess number of dentists. I don't think that you should just send a CV and with a portfolio. I would say that 99% of the CVs that I receive, they don't have a portfolio. 90%. So if you have a portfolio, is better. But let's be honest. Does a simple email will guarantee you an interview? It will not. So I think that you have to have a different approach. My opinion. In my opinion, I don't think that a CV through email it works today. I think you should eventually you can send an email, but I think that if it's a practice that you really consider, I think that you should seduce them. How would I do that? I would message that I would become friends on social media with the clinical director or with the person that works there. I would approach them in events, and I would tell, look, I'm a big fan of your practice, and just be honest. I would really love to collaborate that in the future. But even if it's not possible, just let me see you guys work. Just let me be there and let me learn something, and I will whatever you need. I'll try to help you with that. And another very important thing, which is, you know that some people, when they ask you for something, you are always afraid that you are going to give a finger, and then they are going to ask for the full arm, right? So you have to lower the expectations and lower the stress. It's the same thing that I do when I do a treatment plan presentation. I tell them, look, it's going to be 20,000 if you want, or if you don't want, it doesn't matter. Let's just have a conversation here. So it lowers the stress. So when you meet someone in for a new practice or for applying for a new practice, you have to tell them, look, I know you don't need anyone. It's fine. I'm not expecting anything in the future. So relax about that. I just want to see you work, right? I would just like to see you work, and if there's an opportunity, I would be willing to give you X and Y and Z. What would I be willing to do? Look, I would be willing to develop a periodontal department. I would be willing to develop an oral hygiene department. I would be willing to develop the initial examination structure. I would be willing to help taking more. I would take more. I would photograph your cases. I would do videos of your cases, or I would eventually help you in doing something else. So don't think about paying me. And the thing is that this is so rare today. When I find someone that is willing to give before they get, this is so rare today. Really, really rare. Why? Because I think that people, and sometimes it's true, people, they believe that most of the practices, they just want to take advantage of young dentists, right? And they might eventually be right in some situations, but so they become very defensive. Oh no, this guy is going to this clinic is going to take an advantage of me. Let's be honest. In the first years, you are going to do a lot of bullshit, right? You're going to do some mistakes. You're going to do some things that are not right. You're going to try to extract teeth, and you have to ask someone else for help. So actually, it's like an internship. You are sometimes getting more than what they are getting, right? So you have to not forget that. So always try to give something before you get. And I don't think that email directly works. I would probably go and meet that person, and I wouldn't say I won't appear in the practice without an appointment or without something that is scheduled, because I think that's a little bit invasive. But I would meet them in congresses. I would know where they would be speaking, or if I met them in congresses, or I'll just email them or on social media. Just introduce yourself on social media. Look, this is me. I really admire your work and your practice, and I would like to help you in some other ways. And relax. I'm not expecting anything in the future, but at least let me just, if it's a practice that you really want to work with, there's nothing wrong. And if you have some one or two, this is why it's really important to have like one day off to be able to pull these things, to go to that other practice. I'm just going to go there. I'm just going to watch you work, and I expect nothing in return except for the opportunity. And I would be willing to give you this, which is I would help develop in your practice this, the initial exam, an implant department, orthodontic department. If it's an orthodontist, look, I'll just change the brackets and change the arches of your cases. But I want to learn more from you. And I'm not expecting that you hire me, but I just like to learn that this is how you get inside the practice, right? And introducing yourself and placing yourself out there and telling them, look, I am willing to give more than to what you are expecting. I think this is the goal.
So yes, what you are saying is that being proactive is very important. So
Absolutely.
if you want
Yeah.
something, go after it. Don't. And in dentistry, just nowadays, a CV is just and sending your email with the it's not with your CV,
Yeah.
it's not enough nowadays. You can document your cases. You have social media nowadays that you can introduce yourself. So likability and to be proactive, it's still very important, and it's important for you to differentiate yourself. And also I think that once you go through those first years, it I think that proactivity is also important. So that in order to help the other person understand why you deserve what you are requesting or what you are negotiating, right? So it's like they have to believe your worth, because I think that in dentistry, when you have a clinic, and I was never a clinic owner, but I can understand that when you give someone a job, you are really trusting this
Yeah.
person. So
Yes.
this
With
person
your
is going to
patients.
see your patients.
Exactly. Exactly.
So you also have to bring something to the table to help them understand
Yes.
why you deserve this place, and also why you deserve some working conditions, because like we said, it's not
Yeah.
only about the money. And sometimes I think it also helps to understand that clinics have financial constrictions, and sometimes the
Of
financial
course.
needs might not be able to be met. But there are other things
Exactly.
on the table. You said that already, some of those things. Um,
Yeah. You can
so
even. Yeah.
yeah, yeah.
You can eventually say, look, I know that you want me to work every Saturday, but look, I think I've been doing a good job, and I would like to have like two free Saturdays a month to go out and to spend a weekend. I mean, that's perfectly legitimate to do so, that would be one thing. The other thing would be, okay, just let me one morning a month, let me just document a few cases, or one morning a week, just let me document a few cases. The other thing would be, let me write, let's do a very, very good case together, or something like that. I mean, just take some very good pictures here. And regarding the money, and now we are back on improving. So we talked about improving the working conditions in the place that you are working, or improving the working conditions in another, or starting to work in another place. Now, if you work in one place, and let's now talk about the elephant in the room, which is How do I gain more money in this place? How do I do more of the procedures that I like to do in this place, right? So I think that it again has to do with this, which is you have to give before you get. So let's say, for example, you don't do any fixed prosto in that practice, and you want to start doing that. You can say, look, I think that I've been studying a lot, and I'm prepared to do some prosto cases here. Would you let me do that? And you can start with the simple stuff, but I am prepared for that. And you have to say, look, I am willing to sacrifice my percentage for the first case that I do. Because if you don't have any experience, that's what you have to do. You are learning, right? I mean, if you are doing a postgrad course in prosto, if you have some practice, that's one thing. But if you are not, you have to sacrifice your percentage in the first case. And there's nothing wrong with that. There's really nothing wrong because you are learning to do that. You're not going to say they're going to do that forever, but I would say, look, in the first cases, in the first 10 cases or 20 cases, just let me, I will abdicate for a part of my percentage, okay? I'm just going to make that half, okay? Just let me do some of those cases. That would be an approach. But for that, I mean, look, how can you gain trust of the people that you work? You gain trust by getting there on time. I mean, if you are always 10 minutes late, I mean, do you think that you are in a position to ask something? If you are constantly late for work? Because sometimes people, they ask for a lot of stuff, but the basic stuff, they don't do it, right? Or, for example, you
Or if you are
unschedule your patients.
always, yeah, that's it. If you are always canceling your patients or,
Canceling patients. I mean, if that's something that you can't. Practice policies usually they should prevent you from doing that, but you should never unschedule your patients because you have going to vacation, right? And I mean, my thing is 1 month ahead. I think it's okay. 1 month before, I think it's okay. Less than that, I would never unschedule a patient. And if you arrive late, if you don't have a good working environment, if nurses don't like you, none of the nurses like you, if you don't, I mean, one thing is being demanding, the other thing is like being an idiot. If you are an asshole or an idiot to nurses, no one's going to want to negotiate with you. If you arrive late, if you don't bring some positive energy, if you keep on scheduling patients, you are in no position whatsoever to negotiate. So let's start with the basics, right? Because sometimes we forget that. I mean, just don't be an asshole, right? And just do what you have to do. You should arrive on time. And that's something that I sometimes believe that people don't get this right. They believe that they can, 10 minutes, it's okay. It's not okay. It's not okay to arrive late to see patients. It's very bad. If you can't arrive early, at least arrive on time, right? So, but again, you are in this practice and you did things right. You arrived on time. You were respectful for the nurses. You were respectful for the patients. And you want to do some prosto, right? One thing is to abdicate for half of the percentage that you would be working in the first cases. The other thing can be, for example, okay, so I would like to increase. Let's say the financial conditions are not very good. You want to earn more money. You think you deserve to earn more money. Okay, so where does that money come from? Guess where? Initial examinations. This is where the money comes from. If there is an initial examination, okay, let's try to improve that. If there is none, again, okay, so I would like to create a structure for initial examination in this practice. And again, I know this will bring us more treatments, this will bring us more financial returns. And let's try this for 6 months, let's try this for 1 year. And then if it works, I would like my conditions to be better by X. If you think it's important. And there's nothing wrong by saying that. The thing here is this. If you believe you arrived on time, if you arrive on time, I mean, I think that in a podcast with Diogo Guerreiro, we talked about this. If you arrive clean, if you arrive clean and on time, half of the job is done. Because many people, I would say half of the people, they don't arrive on time. This is really interesting because we sometimes believe that you have to be a spectacular clinician. I mean, if you arrive on time, you are above 50% of people. Most people are really lousy at this. Trust me. If you arrive on time, you are above 50% of people. So if you arrive on time, if you treat people good, if you are cool, if you know how to treat people well, etc., you will be in a position that there is nothing wrong with saying, look, I would be willing to do this and in for a few time, and in return I think that after that you can even leave that open. After that we can eventually negotiate our working conditions, because I would like to be financially rewarded slightly better or a little bit better, because I think this will work. There's nothing wrong by doing that, nothing wrong, but you have to feel that you deserve this, right? It's not about the money. It's because you are willing to do a better work and therefore you deserve this. If you have this conversation and from the other part, the answer is very negative or very surprising or not very agreeable at all, I think that you are working in a place that is not very healthy. That's number one. Or number two, actually, you are an asshole and you arrive late and you treat everybody bad and you are not aware of that. But if you don't do that, if you have an honest conversation with the person, I think that in a practice that it's worth to keep on, you will have an open position. I mean, you'll have understanding about that, and it doesn't mean that you will get exactly what you want, but it will start a negotiation about that, right? Because it's not only about you want, it's what's the best for the both parties, right? For you and for the practice. So this is the start of a conversation, and there's nothing wrong with that. I would like to have better conditions, but please, the trick is always this: let me allow to do a good initial examination. Because if you do initial examinations in between appointments, I trust you that you are not proposing a lot of treatment. You are under treating your patients, in my point of view. This is why, to get adequate time for a good treatment plan, diagnosis, and presentation, this is really the key. If you want to do more of certain types of treatments, you need to do more initial examinations. You need to make that more available in the practice. You need to eventually be available to do that almost for a very little amount of money, because what you will get is very good. And then once you get these results, and this is important, once you get the results, then you are in a position to negotiate your position. Why? Because you brought something to the practice that most of the people are completely asleep. Most of the practice, they have no clue about this, and they don't want to change. If you bring the initial examination, I can guarantee you that you will do more treatment, you'll get more financial rewards for that, and you'll be in a better position to negotiate materials, appointment times, and even percentage. Of course, within some boundaries. And it doesn't
That's
mean
what I,
that, and yeah, yeah.
no, sorry to interrupt you. That's what I was going to ask you, because there are some salary aspects in dentistry when
Yes.
you were working for someone that no amount of negotiation can change. There are some boundaries on
Yes.
that. So as
Yes.
a clinic
Yes.
owner, you have that math done. How much is the cost of having someone working
Yes.
for you, and how
Yes.
much you can pay them. So, and there's no amount of
Yeah.
negotiation that can change that. There's
Absolutely.
a ceiling for that.
Yeah.
So,
Yeah.
and I think that the other person has to be able to understand that those constraints, because and in your case you have all of the math done and you explain exactly why
Yeah.
you are paying what you are paying to the
Yeah.
colleagues that work with you.
Yeah.
But and my question here is, so if you understand these constraints, what can you then negotiate? And you already said it, right? Materials, etc. But I would like you to elaborate a little bit more on
Yeah.
that, because I think that in dentistry there is this constraint, and I hear it all the time. Colleagues
Yes.
saying, "Ah, the clinic owners saying, they have no clue how expensive it is to have a
Yes.
practice. I'm
Yes.
working for them to work. I'm paying for them to work. The whole clinic is depending on me because colleagues, they don't bring any money to the
Yeah.
practice. They have no idea how much it costs,
Yeah.
the fixed costs here. So I think there has to have the person that is going or working on that practice have to have the ability to understand these constraints,
Yeah.
and if there is this ceiling, these limits that have to be respected, how can you then compensate this?
I think it's a very interesting question what you said, and I think it would be also nice that we could link on this episode the link for the podcast of initial examination, and also the link for the podcast where we talk about all the financial aspects. And you are absolutely right. I mean, it depends on the
I will do
country
that.
that you are working. Yeah, it depends on the country that you are working. For example, and I'm very blunt about this. In Portugal, it's almost impossible to pay 50%. It's almost impossible. It doesn't mean that it's some practices do that, but it's very difficult. It's not a sustainable business. I mean, you may be playing with you may be playing with your father's money or your mother's money or your family money, but you're not building a business. You're just surviving. If you pay 50%, well, you can always say, "Oh, yes," but you can charge a lot. I mean, yes. If you charge, I mean, let's say the average. Let's talk about the concept of average. What's the average price of a dentist in a given place, in a given town, or in a given country, right? Of course, that I mean, I charge above the average of my hometown because I think that our services are above the average, right? But price is a very important thing, very important thing. It doesn't price defines you. If it's the higher price, you better be better. You better deserve it. That's the concept of value, right? You better deserve that. Now, 50%, I was saying it's almost impossible to work. Why? Because the average price is, for example, in Portugal, you would have for you to pay 50%, you would have, in my opinion, you have to charge 50% or almost the double of the average price. And that makes it extremely difficult for a practice to survive. It's very difficult to charge very, very, very much above the average. So I think paying 50% for a dentist. It's really, really important. Very, very, very difficult. You may eventually pay, for example, 50% for someone that comes here only to do some very expensive procedures like implants or I don't know, something that is really expensive, let's say, that justifies that. But for regular, let's say for general dentistry, I don't think it's possible to pay 50% of the value of the appointment, right? Because the costs of materials are very, 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 very. I mean, it's huge, the prices of the materials. So I would say that 50% of the profit on general dentistry, which equals about 40% of the overall cost of the treatment, that makes sense. I would say 50% of the profit, which is completely different, right? And sometimes when people say 50%, I'm talking about general dentistry. When people say 50%, it's 50% of the final price. It's very difficult to do that. So, like you were saying, yes, there are financial ceilings here, right? But it doesn't mean there's not always a space for negotiation. For example, in my practice, I pay 40% in general dentistry, and I also pay 40% of the profit in like implants and prosto, because I think that in the prices that I work in the home in the town that I work, I think this is what is reasonable and allows me some potential for evolution in investment in the practice, right, in the long term. And also, if I want to sell the practice, that's very important. I mean, if I want to sell the practice in the future, I need to have it financially sustainable, right? Now, this doesn't mean that I cannot, I don't give incentives to my associates, to the people that work with me. So, for example, if Luis presents a treatment plan that is going to do the implants, and the prosto is Teresa that she's going to do it, he earns a part of that. And if Luis is going to present a treatment plan that includes ortho, and then Margarita is going to do it, he's going to earn a part of that, right? So there's that. So there's always some, and it also depends on you. I mean, if you are working in a practice, and if you are not the owner, if you work in that practice, you can say, well, maybe I can eventually. I'm here at 35%. Maybe I can say, look, I will if my income goes above X, I would like to have some extra percentage. What do you think about that? There's nothing wrong with that, as long as you have the clear feeling that you are also worth of that. That there's a sense of fairness in that. That yes, I've been working my ass off. I arrive on time. I treat the patient with respect. I care about the people. I want to know other people. For example, if no one calls the patient after an extraction, you want to make sure that they call it. I mean, if you show that you are genuinely an healthcare provider, that you are a professional, there's nothing wrong with asking for improved working conditions. Of course, there's a ceiling, but even within those, if you are a good element there inside the team, there's nothing wrong with negotiating that. There's nothing wrong with going and saying, look, I think that I would like to have some sort of incentives, or eventually we can create a system of incentives here. Because I think that that my behavior and my professional attitude, there's nothing wrong with saying that. This is what I think. But also you have to be open to if other people say, look, but yes, you did this, but this and that, I don't think that you were right. And you have to be able to be humble enough to say, yes, you are correct. And I think that's one of the things that sometimes lacks here, is the open communication with other team members, just being honest with other people, having clear conversations about what your expectations are. It's not about giving ultimatums, right? It's like this or it's not like this. It's about a proposal, right? And there's nothing wrong with receiving a no. It's fine. Okay, so it's okay. So you just have to keep doing your work and eventually seek for other opportunities. But look, there's something that I really enjoy, which is easy conversations, difficult life. Difficult conversations, easier life. So it's important to have this conversation that you think that sometimes you're not prepared. That there's nothing wrong with that. Those things make you grow, and those things actually show the practice owner that you have character and that you are willing to have difficult conversations. It shows what you're made of, and it will eventually bring benefits to you. So there's nothing wrong with negotiating your financial situations. But again, you have to bring something to the table. And always remember this. If you think there's something that can be improved towards the initial examination and treatment plan presentation, go for that. Go for it, because that is really the treasure of the practice. That's the secret. That's the heart of the practice. What makes everything pumping is the initial examination and the treatment plan presentation, because that's where you make the money. They don't just go there and say, because otherwise you'll just be doing general dentistry. You have to diagnose and you have to present. How do you do that? You need to have time for that. You need to have a structure for that. That cannot be an accident. So yes, if you are working in a practice and you want to improve your existing working conditions, there's nothing wrong with having that conversation, as long as you also bring something to the table, as long as you think it's something that is fair for you. So there's nothing wrong with that, with improving the working conditions and asking for materials or asking for more hours to see a patient. There's nothing wrong with that.
Okay, perfect. I think that we covered a lot of things here. I will put the link for the episodes that you mentioned to the episode of it.
I would just add one thing. and that you also talked in the beginning, which is sometimes you just have to change and leave, right? There's nothing wrong with that.
I think that's
If there's nothing
also,
wrong.
yeah, and I think that's also, and this has to do with, for example, negotiating your work conditions in a new practice. So in a clinic that you don't know the people, it's very important for you to understand the 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 place where you are applying to. So I think it's very
Yeah,
important for you to really know the culture. So it's that you can align your values. And communication, like you said, is also very important. So if you are working for a place that I don't know, they have values like respect, being on time, so, and providing high quality dental care with good materials, um, you have to really also, because I think that's very, very important, because if you are working in a place that you have to work every half an hour and with not good materials, you will never have the opportunity maybe to practice the dentistry that you want to practice. So I think that's also very, very important, and that also should be taken in consideration. And like you said, sometimes you are in a place where you try to find excuses or whatever, but it's just like your values don't align. You are working in a place that don't let you practice the dentistry that you want, and you can see that by if you don't, the communication is not getting you anywhere. If you keep on doing all this proposals, and like you said, you try to implement the initial examination and the answer is immediately no, or so I think it's very important for you to also be opening to, yeah, to change, and to other places. And also in dentistry, it's a very important thing that you said in the beginning. You might not even like the clinical work, so be open also to change. There's a lot of things that you can do in dentistry nowadays besides the clinical work. So be open to explore other things if you are not happy, and if you reach the end of the day start hating what you are doing and start hating the people. I think that's I say it all the time, and it is interesting because Professor Antonio Mata also said it's not normal if you are a healthcare provider and the people that you are supposed to serve are transformed in your biggest stressors, and you complain all the time about that. So try make yourself these questions: what's happening here that I complain all the time? So yes, and sometimes you might need a change, but sometimes it might need that you feel that you are underpaid, but this all can, I think that we brought this view into this question, that you have to be open to bring something to the table. You have to be open to also understand the person across that you are talking to. You have to be open to also understand that you are negotiating a job offer, not a salary. So I think this is very important in dentistry also, because I think that money comes in dentistry. If you do a good job, if you are happy in what you do, money will come. Maybe you'll never get to
yeah,
be a billionaire. I don't think that happens in dentistry nowadays, or if it ever happened, only being with being a dentist. But you can have good money in dentistry if you are honest, and if you like what you
yes,
do. But I think it's very
yes,
important to consider the whole package. So especially work hours, because dentistry is very heavy. So if you can
yeah,
negotiate your work hours, it will allow you to better keep your work-life balance in order. Also, the opportunity of growth. I think it's very also important in dentistry, because in dentistry you always have to keep up with learning. You always have to be in order for you to be able that you are on the top of your game. You always have to keep up on learning and studying, and
yeah,
so the opportunity for growth is very important. And and there's a lot of things here that can be negotiated, but it's about giving and taking. But I
Yes.
think that, and I think that this was an important episode because the
Yeah.
view that you bring about the initial examination, that it's really a
Yeah.
game changer on the way that you what something that you can bring to a clinic. I think
It is.
that's
It
really
really is.
really really important.
Yeah. And one thing that I would like to add just before we finish this is the initial examination is the biggie. The initial examination will naturally create organization in the practice, because if you structure initial examination, you will see that you will need to structure all of the other aspects in terms of communication with the team. So I would say that yes, you can say, well, I would be willing to structure the implementation of the initial examination here. But when I talk about initial examination, I can also talk about something like, okay, let me just do a protocol for oral hygiene instructions, or let me just do a protocol for what are the things that we prescribe to patients in terms of medication. Let me do a protocol for this. So if you think that in the practice that's something that is not right, just be proactive, like you said. Just be
Proactive.
proactive. Look, I think that here we are. I think that we are underworking here. I think that we could improve this. And instead of criticizing, look, my proposal, I'm going to write down a system, I'm going to write down some structure, and I'm going to present to you in the meeting, or sometimes saying something like this. For example, I think that we should implement a system of meetings here in the practice. What do you think about that? Once a month, let's all do a Zoom. Okay, let's structure that. I'll organize that. Okay, so but you have to facilitate the situation. Or, for example, what we'll also do is I would like to write a protocol for the oral hygiene appointment. I would like to write a protocol for the implant, for the preparation of the implants in the the treatment room for the implants. And I'm going to write down a piece of paper. I'm going to write that down. I'm going to give that to the nurse, because I think that we could improve in terms of infection control. So just do something. If you think that's something that needs to improve, just propose that. Well, you may say, well, they are basically taking advantage of my work. No, you are actually learning. What you are doing is learning in the field, and that lesson will be helpful for you in the future. Eventually, if you even want to open your practice, or if you go to some other practice, because you already have work done. So don't feel that you are being taken advantage of, because you are always learning in the early days of your career. You are always learning. Yeah.
Yes,
So
yes,
I think
yes.
that was a good one. Yeah.
Yes, and also, if you want to know much more about this, join us in our conscience leadership course, because we
Yes.
give you all
Yes.
the. I mean, you give all the protocols and all the systems that, in order to make your clinic work that way, in a structure way. And we also work on the mindset, on the
The
growing
mindset.
mindset,
Yes.
which is
Yeah.
very important, because what I think that what you just said, for you to be able to shift that perception of being taking an advantage to no, 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 this is a learning opportunity. It's really the difference between a fixed mindset and a growth mindset. So and I think that actually that's what we do in the course. We give both perspectives, so the structure and the mindset perspective. So just go to softbites.online and you can read all about our course. But that's I think, if you are interested in all these questions and how you can bring this to your clinic, you should consider in joining us. So, and another thing, don't forget to document your cases. I think this is very important, because I think in dentistry, and you said that you have a clinic, and you said that it's the most CVs that you get, it's still just a CV, right? So it makes no sense in dentistry that nowadays, with the technology that we have, just I mean just document your cases and join them and put together a portfolio, and together with your CV, it makes all the difference. Because if we are talking about to make someone understand why you should get hired, so that's not better in dentistry. I think that's key nowadays. I think that's key nowadays.
Yeah.
Okay, so
And
thank you.
we haven't mentioned
Yeah,
that much about this. Sorry, we haven't mentioned that much about this, but there's nothing wrong with working in a country that will give you better conditions. There's nothing wrong with that.
yeah, of
I mean,
course.
it's just, it is what it is. If you think that, okay, this is my goal, I want to be financially independent from my parents, and I will not be able to do so here in the meantime, there's nothing wrong with that. There's absolutely nothing wrong with that. It can be a very wise decision. It depends on each case. You just have to evaluate things. You can go there for a couple of years and then come back. You can go and stay there. You can work here and there. There are many ways of doing that. But I think it's just have to experience and test and just do something. Just do something and try to experience what you think would be the best environments for you.
Yes, yes, absolutely. And I think that's what we always, I think every episode we say this: do what feels
Yeah.
really, experiment. Because I think that, I mean, it's not only in the beginning; it's across our our whole life.
Yes.
We
Yes.
have to really see what feels right for us, not what we should or are supposed to do, but what we really believe that it's the right thing for us. Thank you so much, Andre.
Thank you. That was a very good one. We are getting better at this. First of all, I think that my
Yes.
microphone is much better now, but we
Yeah, I
are
think
getting better
the
at
sound is
this.
the sound is much better. Yes, and yes, it's
Yeah.
always a pleasure. And thank you everyone for listening to us. Just go to Soft Bites online, read about our course, and we see you on the next episode. Thank you.
Thank you. Bye bye.